Thank you, Debbie, and good morning, everyone. It's good to see everyone here, and I would like to first start by saying, this is a historical look that we did, and there's a lot of history. So we will go through this fairly quickly. But I also want to say a couple things before we started. I want to first thank the Roundtable for doing these sorts of workshops. We are not health people, and the sense that we would have an opportunity to talk to you is actually quite important, because many of the challenges that we are trying to tackle in the context of economic development and individual realizing of potential is inhibited by health issues. And for much of what we do, that's an invisible barrier, because we're looking at school performance, or we're looking at job attachment, and in many instances it's the health that is preventing success there. So to have an opportunity to think about this in a broader sense is actually quite important. I liked how Christopher introduced himself as doing local multi-sectoral collaboration. That's what I think all of this is, and success will only be reached if we find ways to do that effectively. I wanted to just say that our paper is really designed to provide food for thought for the day, and to give a sense of what the potentials can be. As you go through the rest of the day, I hope that the frame that we try to put on this issue is something that stays in your mind, so as you hear the folks that come later on, you have that in context. I was going to say what you said, Debbie, about the new. I do think that sometimes we try to be more creative than we have to be, and there are many potentials that are in front of us that if we are thinking about it in a creative way, it doesn't have to be brand spanking new. There are things that are there, and there are sometimes low-hanging fruit that we can jump into. Now, we were given a charge to try to provide some examples of what works and what has worked, and give you a sense of the dynamic that allowed there to be sustainable and financing that happened at scale. So this is how do we get things that are at a larger scale. In thinking about this, and we tried to span the entire area of social determinants of health. So we provided our own categorization, so this is not something that is generally and widely accepted, but we're going with it anyway. And we looked at the home as one category where social determinants are important, the physical environment in which people operate, the neighborhood that people live in, and the surroundings there that are important, and then also economics as an issue. And so what we hope to do, and what we're going to do, is give you examples in each of those areas. So in home, in environment, in neighborhood, and in economics, of examples where we have seen initiatives that have been successful, and those initiatives that really have gotten to scale. Now, as you listen to it, there are two things that I want to just emphasize. The first is that, at the very beginning, George talked about the notion of resource allocation. In all four of these cases, there are lots of resources that have been reallocated. And we don't talk about it so explicitly because some of them were brand new, but resources shifted into the places that we are going to highlight in pretty substantial ways. And then the second thing I'd like, as you listen, is to think about two aspects of these policy issues. The first is, what was the institutional arrangement that prevailed that allowed success to happen? And how did these institutions come together? This is some of the multi-sectoral stuff as well. And then the second is, what were the sources of the financing that made sense, that carried the day? And I think for the whole day, I think those are the two dimensions that I'd like for you to focus on, institutional arrangement, and then where did the money come from? And I think what you'll find is that sometimes it's not new, it's just different, and that difference is important. So with that, I will turn it over to Anthony and have him walk you through the examples.